So tell me when we're ready to go.
You're on it.
Okay, so I've been asked by some folks to go ahead and kind of give you some ideas of things that just kind of regularly come in. Now, we get a lot of complex things. So in this situation here, I've got a young fella right here who actually had a horrible incident where he had a knee replacement, and he actually has 2 knee replacements, okay? The one knee replacement went bad, got infected, so they had to go ahead and basically, stitch his knee together, if you will, surgically, and now he's got a different knee in there now, but his patellar tendon's still, not good. So what we're going to do is we're going to kind of give you an idea of how we work on some of the complexities in here at In Chiropractic and Wellness. So it kind of gives you a little bit better idea that, listen, we don't just treat the athletes, we treat complex, and also not everybody gets, the hashtag smackdown as you go ahead and you see it. So another aspect, if you will, with this young fellow here is that he also has cervical fusions in through here. And which ones are fused? Is it 5, 6, 7?
C4, 5.
Okay, C4, 5 in through there. So you're also going to be able to see today how I would treat somebody who actually has cervical fusion. So we got a potpourri of activity right here. So we're going to go ahead and rock and roll. So right out of the gate here, I noticed that he's actually got, a big old knot right in through here. So I know, just with some of those things, some of the nuances that I got to work on. So just bear with me, and we're going to go ahead and have some fun here. And this may take a little bit of time, okay? Because, you can't really move too quickly on this. Now, I can't bend his knee here to go ahead and check to see what the second phase is. So he is a little short over and through here. I do know that. So we'll go ahead and we'll mark that. And, of course, cannot perform the second position. First position we can. So since that's the case, I have to kind of do some of the old stuff. So you can see, as you look at his feet, I push on this side here, both of his legs are really locked up. It's worse definitely on this left side and through here. So that's another piece of the puzzle. So I've got both sides. So one's going to be with a block, the other one's going to be without block. Okay? A lot of what we do is getting in here and just setting up and making sure that we see and we know what we're dealing with in through here, okay? So, we'll go ahead and get in here and just kind of palpate a little bit of the springiness. And even in through here, it's just not very springy, okay? All right. So his sacrum is locked up. You know what, Phil, let's see if you can raise that right leg up, okay? So right leg back. Got it. Down. How about the other one now? All right. It's amazing, isn't it, how your body will compensate? You see how he twisted in there a little bit to go ahead and try to get that. He's actually one of these sportsters who is very familiar with how his body's supposed to work. So this will be good. So I'm going to set this. Okay. Now the big smashing sound that you hear is the table itself. And I'm putting pressure in here, but the noise of the table, that's what you're hearing. Okay. So now I feel in through here, see at the springiness. See, and he's still locked up in there. When you have gait cycle disturbances like this young fella does here, where, his knee, both of his knees are just kind of destroyed. And then, of course, no patellar tendon on the left. There's a lot of work here. So let's see what that did to that. A little better. That's a lot better. Okay. So what I want to do is, there's other nuances in here, obviously. And then also at the same time, I know he's got a knot in here on this side in here. So I know there's a trochanteric component. So what I'm going to do is I'm going to go ahead and break that down real quick. So go ahead and lift this up here just a little bit for me so I get this under. Gotcha. Okay, just like that. So what I'm going to do is, since his knee on that side is still functional, I still have to be cautious because it's also an artificial knee. So, and he's awful young to have that kind of thing happen, but it is what it is. So what we're going to do right in through here is bring this in here, and then I'm going to go ahead and connect in through here, and definitely not putting pressure on that knee, okay? And open that up. Did you live, Phil?
I did.
He did. Yeah. That'll wake you up in the morning, there's no doubt.
Yeah.
But that's moving, and that's moving. So that's a win for us. All right, now his legs are the same length, okay? But I still know that there's some catchy, hangy stuff in through there. So we're going to go ahead and take some of that out too, both on the sagittal component as well as the coronal component, okay? So what I got to do is got to put this in a good position. So go ahead and lift this up a little bit. There you go. Gotcha. Is that pinching in your pocket stuff? You okay?
Good, yeah.
All right. So, and then I've got to take this in through here. Hang on. That's right through here. Got to move this in the right spot. This is why we take x-rays. So we know exactly where to put things. And I got a lot of colleagues that don't even know how to read x-rays anymore. I don't even know what's going with that. All right, so going to be a combo again. And I'm going to take a twofer right in through here. So I'm going to work on the PI component here. Use the soft part of my forearm so it doesn't hurt that hip of his too much. And then I'm going to hook right in through here on this AS and drive it straight down. Just like that. Now there's speed in there. Speed and force is what we're using, okay? Now, I also got to finish out what we've got right in through here. There we go. Nice. Okay, so take that in through there. And I'm going to leave this now, all right? Because this is the corrected position that I want. Now, it's not SOT, but we're using SOT blocks, okay? So, there's other components here that are definitely problematic here. And so, as I go ahead and I run through my list here, you see all the colors, okay? Those colors they stand for complexities of the case in through here. So, there's certain things that I got to watch out for and stay away from. And so, that's what all this is in through here. So, what I need to do here is kind of feel around, see what I got. And I'm going to give this a little bump in here. You see how much I'm not using a lot of force, and yet those are moving, aren't they, buddy? Now, if you've got all these extra little, we're going to call them nuances, you need to make sure that we're not putting too much in there for him. Now, because of the shift, is it any surprise that there's a little bit of a bow in here like this? Got a little bow in here. So what I'm doing right out of the gate is trying to reduce that bow because there's a biomechanical dysfunction here. And of course that's all controlled by the neurology. Now we're getting close to his surgical stuff up here. So, more fun, right? So what we're going to do right in through here is without turning his head, I'm going to set in here on these ribs. Typically I focus on the first three in here. The reason I do that, the first two actually have a lot going on with the scalenes. Scalenes attach into the neck, and even though he's got the surgical stuff in through there, we still have to get in there. Now, this side is worse. Big shocker. You would think, you're left-handed too, aren't you?
Yes.
So he's left-handed, but he's still got the right side that's crazy bad. And you feel that pull in your neck, don't you?
I do.
Now, I'm not even touching his neck. What I'm doing is I'm setting those ribs, taking the pressure off those scalenes. All right, I'm going to run right over here. So you kind of get the gist of what it is that's going on here. All right, now I can get right in here and be just fine and stay off his surgical sites in through there. Go back in through here. Some of it takes a little bit of pressure and power in your hand when you get in there. There you go. And that's speed, okay? That's not necessarily power in there on that one. But you can feel it moving, can't you?
Yes.
There, did you feel that one?
Yeah.
That was what was left. So the rib heads on this side actually popped posterior and through here. So we had to finish that junk up too. Now, I'm going to go clear up the top. The atlas and axis are fine, which is the first two bones underneath. So rather than get in there and cause some risk to them, we're going to use the tables again and drop that right in there like that. Now, you felt that go across your medulla oblongata, didn't you, buddy? Definitely. Yeah, that's where your brainstem is. So it's important to clear that so his body can heal and do the things it needs to. Another one? There you go. Now the nice thing is that there is no doubt in his mind whatsoever I did move the bone. But at the same time I moved the bone safely for the kinds of issues that he had. Now, got another little bone in here that I've got to get to pull that off. There you go. And you feel that one there. I call that little booger the Hidachi bone, which is a fancy way of saying headache. All right, so now, I'm pull this out. You doing all right, buddy?
Yes.
All right, good deal. So, anyway, go ahead and raise your right leg up as high as you can now. Okay, good. And how about the other one? Okay, good. Still even. I think that's higher than where we started, but I've got some other components in here. Because his hips are moving so out of sorts in through here, and they lock, there's a muscle called the iliolumbar costalis in through here. In other words, it goes from the ilium, or the hips, if you will, the top of the hips, and the muscles actually get in there and they catch in here. So a lot of people will say, well, my QLs are tight. Well, it may not be your QLs at all. It's probably your rib cage that's getting locked up in there. So what we're going to do is we're going to go ahead and open that up for him. And of course, you got to be careful. But these here are floating ribs down at the bottom. And so all I'm doing is just kind of give him a little shock factor. Here we go. And not too painful, is it?
No.
But you feel how that gives?
Yes, it does.
That was like a rock before I got started in here. So what we'll do now is let's go ahead and have you raise your right leg up again high as you can. Good. How about the other one then? Good. Okay. How's that feel to you?
Not bad. I think
You got good motion now, yeah? Okay, good deal. All right, so I'm not going to show you his face, patient confidentiality issues here. Already gave his name away, that was bad enough, but we're good, we're old friends, so
Yep.
it's a good thing. But you got to go ahead and force that HIPAA thing. So listen, you know what? If you're having high level complex issues that are really plaguing your life, get in here. We take care of a wide variety of different situations. People on average, I hate to say it, but people are driving at least 45 minutes to get here. We got pro athletes that are flying in from Colorado. They're driving from Iowa. I'm doing consultations, believe it or not, in Norway. There are a lot of people that really need help. And so, that's what we're here for. And so give us a call. If you want, go ahead and take a look at the website if you've not already tried it. Go to inchiropractic.com. Give Kim a call over 317-770-5775. And if you're one of my athletes, see you at a contest near you real soon. Take care and have a great day.